Hi everyone, my name is Xingjie and this is my partner Yu. Our topic for today is ethical issue in couples and family therapy.
Okay, so in this presentation, we will walk you through two case stories and ethical discussion from two of us, followed by differences between couple and family therapies and individual therapies to end this presentation. Thank you. Now I'm going to introduce you the case story of Louise. So first, Louise and her husband have been married 8 years and have a 2-year-old boy. Next, she found intimate texts on her husband's phone with a phone number she don't know. The text rocked her to a core. Her husband denied having an affair, but was not happy in the marriage either. So he agreed to come to couple therapy with her. So the therapist is working on improving the communication of their needs by giving them homework to do between sessions. But Louise felt hard because they are fighting, accuse one another of being insensitive to the other's need. Also, the therapist challenged her as often as her husband. She thought therapy would be different. She simply thought that what her husband did was wrong and wanted him to fix it. But she also finds it helpful in the same time, as she is learning what she may have played a role in him looking for a connection with someone else. However, the therapy and their marriage consumed her thinking. She felt better as often as not after a session. The end of the story. So the dilemmas we found here is that should Louise go for individual or couples therapy? Okay, so although Louise finds it helpful, she was not happy about it or feels better. Louise might feel better or figure out what she wants in the marriage after an individual therapy that is more individual-centered. However, Louise go for couple therapy and insisted her husband to change. Dilemma 2. How shall Louise know that the therapist is helping her? Okay, we all know the aim of the therapy was to help the client to improve or to solve their problem. But Louise feels that their therapist challenge her. Like her husband, she doesn't feel like the therapist is helping her. So it doesn't reach her expectation that the therapy will be different. So let's talk about case story 1. So I think for dilemma 1, individual therapy or couples therapy, I think Louis should opt for individual therapy because individual therapies will help Louise to cope with the distress issues in depth since she was upset. A question like why she feels so, what does she feel, and how she faces it could be addressed by an individual therapist. She also needs someone to support her after this shocking news. And then the individual therapist can further identify her belief system, and all this can make her be clear and feel better. At the same time, I think if she wants, she can go for couple and family therapy too. Means that have two at the same time. So it can also this can help her see clearer how her behavior influences the relationship. What do you think, Xingjie?
Yeah, I agree with your point too. But before going to the individual therapy, I think Louise can first tell the therapist what she feel about each session because
Okay.
open up with the therapist about how she feel. Actually, the therapist can work with her to solve the problem and continue the session. So if Louise open up, then the therapist will have the chance to explain or tell her like what the therapist is actually doing and why she do that. And Louise herself will have the chance to understand how the therapy session will help her too. So I think this will help to improve the progress of the therapy session also.
Oh, yeah,
Yeah.
yeah. I agree. I think both of us then means that you suggest that uh do not go for individual therapist first, but talk to the therapist first, the couple and family therapist
Yes.
first. Okay. I think my points and your points stands out. So just leave it here for dilemma 1. Both of our
Mhm.
points stands out. Okay, so move on to dilemma 2. Okay, how shall Louise know that the therapist is helping her? Okay. I think the therapist should assess Louise and her husband's expectation in most of the sessions, okay, to see if they are doing the client best interest. So this is to practice the principle of fidelity and responsibility as stated in APA 2017 page 3. Also, Louise seems to focus on her husband while her husband seems to focus on the relationship. So I think that the therapist shall see how to address this problem or these two needs in the treatment plan. The therapist shall inform the client that the challenge given was to help them without the aim of attacking or criticizing a person. Since that she said that she feel that the therapist is challenging her, like her husband.
Yeah,
Okay.
I agree.
Okay, the client shall be okay, thanks for that. The client shall also be informed that they can comment on the technique and refuse whenever they feel uncomfortable. Okay, what do you think?
For me, in for the dilemma too, I think the therapist should always explain what she is doing and why she do that, and to mainly to let the client understand more about the therapy and also to gain trust, like what you say. And in my opinion, the therapist should understand that the process of changing or adjusting thoughts, mental state, or any habit is actually not easy for the client. So the therapist should, or I mean, can tell or comfort Louise that actually the therapy session and the process of adjusting with her husband will will let her feel uncomfortable or may feel some
It's
weirdness.
normal. Mm-hmm.
Yeah, but the therapy should always tell her this. It will always bring her to a better outcome
Mm.
and encourage her to try to continue the therapy.
Yeah, yeah.
And the therapist should also monitor Louis, because if after some time Louis still feel uncomfortable and think that this therapy session
It's
doesn't,
not suitable.
yeah, it's not suitable, then the therapist may need to take some action, rather either change some plan in the therapy session or refer her to the individual therapist.
Yeah, yeah.
Yeah.
Yeah, yeah. I think you agree on this. I agree your
Yeah.
point. Yeah, yeah.
Mm. Thank
Okay.
you for.
Okay.
Case story of Liam. Liam is a counselor working with two brothers whose parents are divorcing. The boys are being seen because their behavior and grades are reportedly being negatively affected by the situation. Their parents have joint custody, each retaining their parental rights, and their mother has physical custody. Parent with a physical custody will be the parents that provides care for the child on daily basis. It can also mean that the child will live with the parents that has physical custody. During a counseling session, the boys reveal that their father has punished them by hitting them and locking them in the closet for extended periods. Liam chose not to report this since the boys have requested that not to tell anyone. Weeks after the boys' disclosure, their mother informed Liam that she wants him to give his opinion to the court regarding which parent should gain sole custody of the children. Sole custody is a child custody arrangement whereby only one parent has custody of a child. Additionally, the boys' father has requested to access the children's record. That is the end of the story. There are some dilemmas in this story. First, should Liam report the boy's father? Liam, the psychologist, shall abide the Principle E in APA 2017. That appointed psychology is responsible to safeguard those vulnerable children that can't make their own sound decision. Instead, he chose not to report just because the boys asked him to. Second, should Liam give his opinions? Counselors have to document the session notes and other files for legal cases like custody. But here the boy's mother is asking her opinion. Shall he keep his client's best interest, or shall he let the court decide? Third, confidentiality and potential harm. The boy's father requested to access the boy's record. Due to the boys are minors and he is their father, Liam can disclose the records. But at the same time, their father has suspected of abusing the boys. Liam can refuse to disclose the records too, to protect the boys from their father and also keep the confidentiality of record. Now we will move on to discussion.
Dilemma for case 2, I think Liam should ask the boys for more details so that Liam have more detail when reporting to the police, and also to prevent the boys to be scared when asked about the details by the police after the case is reported. And I think Liam should also check on the accuracy and reality of the case or story told by the boys.
Yes, to see if it's a real thing or a fake thing, right? But I think before telling the authorities, they should at least inform the mother, who's the one that has physical custody, about this potential harm. So if they suspect there is harm, so Liam and their mother shall decide whether to inform authorities or not.
Okay, and I think Liam should organize the data he got so that in case they will file a police report in the future, it will help them. Yep.
Yeah. Yes, I agree. The point of reporting to the authority is not to just arrest the harmful third parties, but also for the authorities to increase surveillance or other crime prevention based on their judgment to prevent harm. So if Liam do not do this, Liam will put himself in a future legal conviction if anything happens to the boys, like abusive acts from the father in the future. What do you think?
Yeah, I think I agree.
Okay, so the first dilemma ends here. So the second dilemma, to address the second dilemma, should Liam give his opinion? Okay. So according to the APA 2017, page 9, psychologists have to create, have to store, have to access, transfer, and dispose of document properly. So if the court requests for the session notes or the report, I think Liam should give, but only a limited part. And I don't think Liam should give the court his opinion, as it is unethical to impose his value on the client situation, especially in court. But I think she can include the boy's feelings toward their caregiver to the court as the court reference. Given that sole custody was not pronounced yet by the court, it's only a suggestion by the boy's mother. I think he should be as neutral as possible in writing the document for maintaining or for practicing justice as a principle in APA 2017 in page 4.
I agree also. But I have something to add on is, in my opinion, he can seek advice from trustable colleague or seniors, and he can also ask some advice from counselor or therapists that face the same dilemma before, like him. And additionally, stated by APA 2017
Okay.
in page 3, psychologists consult with, refer to, or cooperate with other professionals and institutions to the extent needed to serve the best interests of those with whom they work.
Mm-hmm. Yeah.
Yeah, so let's move on to the third dilemma.
Mm-hmm. I think we agree on disclose the document, session notes, etc. Yeah, let's move on to dilemma 3.
Okay, so uh, For dilemma 3, if the police report was made earlier, I think Liam shall then ask the authorities suggestion, like whether or not to give the boys records. And all of the action shall be documented to protect Liam himself. For example, if the authorities do not limit the father to access the record, and the father become more abusive after that, Liam can prove that he done his best to abide non-maleficent by
Uh-huh.
asking the authority.
Yeah. You mean the third dilemma is the confidentiality and potential harm, like whether the father can have access to the boy's record, right?
Yeah.
Yeah. Okay, I agree with you if the report was made. But if the report was not made, like maybe after Liam and the mother discuss and they don't want to make any report, uh the father still have custodial right to access the file, right? So I think before anything, Liam should address the nature of confidentiality in therapeutic relationship with the boys to the father. Like, why is keeping confidential important in this helping profession? So, uh, also he have to let the boys know that their files are accessed by their father. And when handing the document, I think only the part that was requested shall be given to protect the client, which is the boys, from potential harm, and also to maintain the trust in this therapeutic relationship.
Yeah, so our dear classmate, what do you think about this? Do you think our suggested action prevent harm? So please think about it. Thank you.
Hi, now I'm going to address the differences between couple and family therapists and individual therapists. So in Principle B of APA Code of Ethics 2017, psychologists uphold professional standards of conduct, clarify their professional roles and obligations, accept appropriate responsibility for their behavior, and seek to manage conflict of interest that could lead to exploitation or harm. So here it briefly addresses the psychologist's responsibility. So now let's look on the first aspect of our differences, roles and responsibility between these two kind of therapists. So in here, see the couple and family therapies, in short, I will say it as CFT, and individual therapies, I will say it as IT. So I hope you keep that in mind while listening to our presentation. So CFT train and practice in this form of therapy, couple and family therapy, and also individual therapy, while individual therapies, IT, only train and practice in individual therapy. CFT be clear about their commitment to each member of the family or relationship, while IT aware of suicide signs from client and provide a safety plan when necessary. CFT address the limit of confidentiality, which is the secrets hide from each other. Means that the therapists have to address the limit of confidentiality or when to break the confidential, which means that they might have to say the secret of each member in the relationship to the other for the purpose of treatment. While for IT, the limit of confidentiality is the risk of danger to the client and others. This simply means that the therapist might have to break the confidential when he or she discovers the danger, the risk of danger. Next, CFT help every individual to clarify and find values that they follow. IT, on the other hand, help clients to reduce unwanted behavior and create a new habit, which is similar with CFT, but then looking in another way. CFT assess client problem in the family context, focuses on the problem in relationship, while IT assess client problem in individual development and focuses on the problem in that person. Next, CFT understand and focus client expectation of the therapy or what they want to accomplish in the relationship, IT also understand the client expectation of the therapy or what they want to change in themselves in this as a person. CFT deal with clients that encounter divorce, separation from partner, unsatisfied relationship, problem with children, and have financial problems. IT might deal with abnormal client and those with substance abuse. So IT also responsible for referring client after evaluation when their condition needed another service. Means that, let's say, for example, the client is a drug addict. So this drug addict might have a symptom of drug withdrawal. So after the therapy or during the therapy, if the IT found that this client needed some other help, he or she shall refer this client to medical service. Next, the last comparison is CFT provide individualized treatment plan that address personal and mutual issues for everyone in the relationship. While IT assess the client functioning, it will do the same thing as CFT, but in addition, it will access the client functioning to perform daily activities. So we're done with the comparison. Now I'm going to show you just a few, two other roles of CFT. So CFT write reports of parents and children for legal use in case of divorce and child custody. This one we will see it again in our case story too. So stay tuned. Other roles, which is the last roles that I use in this presentation is, for example, some therapies, they will use couple and family therapy for solving an individual problem if this problem is caused by the family or partner. So this approach is only focused on one person. Family member or partner will attend this session, and counselor has to help this family member or partner to understand the client problem, that one client problem, and help them. Besides, counselor will also work with client alone to develop his or her coping mechanism toward another family member and partner. If the problem of that individual is caused by the family member or partner. So this is an interesting example of how CFT uses this therapy to help solve a personal problem that is caused by a lot of people. Okay, finish with the roles and responsibility. Now let's move on to advantages. So what's the advantages that both therapies have? So I picked two here. First is that couple and family therapies have more advantage in addressing problem of client with others by seeing it in a system approach and eventually achieve the goals of therapy. So CFT see the client problem in a system approach, like how the nature of the client causes the problem that the client have. So it can actually solve the problem and reach the goal of therapy, which improve the client. And then the second advantage of CFT is that manageable conflict, as the client will direct their emotion to the other member in the relationship instead to the therapist in individual therapy. So it's normal that in CFT there's a lot of conflict in between, but then this conflict is direct to one another among the member, not to client. If it is individual therapy, the conflict will direct to the counselor, to the therapist, like, why do I feel this way? Like, when this client have a lot of emotion, it will direct to the individual therapy. So CFT is a bit different. Okay, so after all that, let's look what benefits does individual therapies have. So transference are much more effective than couple and family therapy, as the client can transference with ease when the subject of transference, which is the family member or partner, is not present. So here, for example, if client A has a problem with her mother, and if her mother is there in the family therapy, he can't really do transference or want to say the things that she always wanted to say, cannot solve his own personal conflict with the mother in a transference way, since that is there, so there's a limit. But if this client is going for individual therapy, it will be much more easier for the therapist to see her problem. Okay, second is that there's less frequent conflicts compared to couple and family therapy. So this is like what I said, although the conflict is directed to the therapist, but there is less conflict. Right, there's only 2 persons, but let's imagine if it's a family therapy with 5 family members, you can imagine how many conflicts it can be during one session. So that's all from my part. Thanks.
So now I'm going to talk about the technique on handling ethical issue for both couples and family therapies and individual therapies. Although they have some difference, but they share some similarities when it comes to handling ethical issue. So now I will talk about some basic and common technique. Therapists can seek consultation when faced dilemmas, and make sure therapists do not counter-transference their own values towards the client in the therapy. Instead, the true value of the client should be found that aligns with the outcome of therapy. Stay objective and non-biased on any side, and also report if found any illegal acts. So now we'll move on to a more in-depth technique, a suggested ethical decision-making strategy given by 2 psychologists on their own website. So the first step is determine whether the matter truly involves ethics. So the case need to really involve ethical issue. And step 2, find out all the available facts or information before proceeding to the next step. And third, refer existing guidelines that might offer a possible mechanism for resolution. For example, the ethic codes by APA, ACA, or American Association of Marriage and Family Counseling. Step 4. Pause for a while and think about all the factors that might influence the judgment or decision the therapist will make. So the therapist need to make sure there's no other factors that affecting his or her judgment. And then step 5, consult with a trusted colleague. Because ethical decision making is a complicated process, so it might be influenced by therapist's own value and perception. So there's always benefit by seeking others' opinion or from your trusted colleague. So step 6, evaluate the rights, responsibility, and vulnerability of all affected parties. For example, can consider confidentiality of the affected parties. So step 7, generate alternative decision. In this step, the therapist shouldn't generate only one decision, but many different decisions. So the next step, list down clearly one by one about the consequences of making each decision. And step 9, make the decision, choose the best option. And last one, take action according to the decision. So that is all from us. This is our reference, and thank you for listening.